This is KPFT in Houston. I'm Wally James, and with me in the studio we have Audrey Nath, and
I'm a neurologist.
she is, and you want to tell us what you're concerned about this evening.
Oh, Wally, thanks for having us. Today's a hard day. With the passage of this bill, I'm very concerned for patients. I'm also concerned for medical education and educating the next generation of physicians. So, for patients, there's all sorts of sneaky, hidden things that this will affect. For example, for hemodialysis, so people who have kidney failure who go in 3 times a week and get hooked up to the machines to clean out their blood to keep them alive. Now, if you are above the poverty line, there will be a $35 copay for every time you do dialysis, which adds up to about $5,500 per year. So for someone that's right around the poverty line, that might not be an amount of money that they can pay. So I think what's going to happen is people are going to cut back on how much dialysis they get. And the reality is then there will be complications and we'll have more patients in the ER. So it keeps going from there though, because then if the hospital isn't getting as much Medicaid reimbursement, then services are going to be slow and hospitals will close. I talked to a friend who does emergency medicine at a rural hospital, and he was telling me that this hospital, if they were to stop getting payments in, has about enough cash on hand to survive 10 to 14 days. So that is how close to the edge a lot of rural hospitals are functioning. So we're going to see hospitals close. I know Senator Markey's office put out a list of hospitals that would be in danger, including 15 in Texas. On that list was, I think, Scott and White Marble Falls, which is a hospital that people go to. But then on the other side of it, there are people from the hospital that then get discharged to a skilled nursing facility. And many of these are Medicaid funded. So what's going to happen there is those will close, and now we have a bottleneck, right? So then patients won't be able to get discharged to the skilled nursing facility, but they're too sick to go home. So they'll be clogging up the hospital, right? So you kind of see that this is like a cascade of problems where more patients will be coming in to the hospital because they're not getting their routine care because of expenses with that, like the dialysis example. Then once they're in the hospital, they might not be able to get a bed as quickly because on the other end, patients can't get discharged to the skilled nursing facilities. So we're going to have huge bottlenecks and just hospitals that close, which means that the rural folks will then be coming to the urban hospitals, and those will get busier. So you can see the cascading effects of how this will go. We all need to kind of steel ourselves for increased wait times at the least, but there's going to be people that just don't get care. We're going to see increased mortality. People have already calculated this.
It's awful.
It is.
Well, and they lie. They say, this is going to improve things, when clearly they're taking people's lives in their own hands, and the people who need the most, who have the least, are the one that's being targeted. It's like Trump and his cohorts want to kill people that don't fit in their crowd.
What's interesting, Wally, it's interesting that you say that about not fitting in their crowd. When it turns out at this point in time, in 2025 demographics, many of the people that will be affected by the Medicaid cuts are in red counties and are Trump voters. But it's interesting that you bring that up, because that sort of playbook, maybe from decades ago with like Paul Ryan and them, let's cut the SNAP benefits, let's cut food stamps for the poor people, and that might have affected Democrats more. But now it affects Republicans. I guess they just don't care at this point.
Oh no, they're going to get through what they want, and they will get paid off. And they don't really care about what happens to poor and working people.
Absolutely. Alexandria Ocasio-Cortez, I think she made the comment like, hey, look, when I joined Congress, there was onboarding and I could sign up for insurance and it was these great plans. Well, why doesn't everyone get that?
Yeah.
Right? And so that's the thing. They're shielded from this. They're not going to be affected personally. And I think that's a problem too.
Well, and when I was working, the company I worked for, they had insurance. Not
Yeah.
to say they didn't pay something out of pocket, but now so many businesses don't offer that.
Absolutely. I mean, there are businesses that will specifically hire out consultants to trim down on their costs. And sometimes what the consultants will end up doing is say, hey, if you decrease everyone's hours to just under 32 hours a week, you don't have to pay benefits, right? And so there's more and more of this where people might be wanting to work full time and still not getting full benefits. And I think that kind of brings up a point that I've heard many talking heads say, like, able-bodied young men, they don't need Medicaid, they should be kicked off, which is so strange because many of them are working jobs that don't give benefits, and
Right.
young men get sick too, which is I think it's like a fundamental lack of understanding of what insurance is. It's that any of us are one phone call away or one car accident away from needing care, and we all have to share that risk. That's the whole premise, and I think there's like a fundamental lack of understanding of that. Instead, it's like, well, you're healthy now, you're fine, you don't need insurance. That's not how insurance works. So I think what I think needs to happen is, so this is terrible. It's going to take a long time to repair, but I hope enough people see what's going on to, I hope, prompt a progressive revolution where we get health care for all. Because only with universal health care can we avoid shenanigans from happening like this again. Because the Affordable Care Act, a big chunk of what the ACA did was boosting up Medicaid. That was a big component of how it worked. And now, that's basically being erased. So I think the only real way forward for us is universal health care, which would be cheaper. Because the countries that have universal health care, they pay less per person. Which is a whole other rant, but I think it's relevant. Basically with our for-profit system right now, for one, a whole bunch of profits are going to the top of these companies. But also, there's so much red tape, and they have to hire huge staffs of people to try to deny every claim. We could just cut all that and have way less overhead. Mm-hmm. So I hope that's in our future. We're all fighting for it. We're going to go down fighting for it.
Well, something has to be done.
Yeah.
And it's going to affect so many people. And even well-to-do people have family members that aren't well-to-do.
Well, there are well-to-do people who live in rural areas.
True.
You know what? If you have Medicare or if you have private insurance and the hospital closes,
oh yeah,
well, it doesn't do you any good if there's nowhere to go. So just hope that you don't have a medical emergency when you're driving through that town. But yes, it does affect, it's not just people right on the poverty line that this affects. So I talk to medical students and I still do some teaching with residents and fellows. One thing in this bill is that it affects the ability for people to take loans for education, which I think will just really hit private education really hard. So it puts a cap of $200,000 in total loans you can take for undergrad and, say, medical school. You can try to go to your state medical school, but even going to your state college and state medical school, you may get more than that, or maybe some people didn't know this and went to a private university for undergrad. So long story short, if that number is capped, that means any more that loan that you take out is going to be, it could be at a private predatory rate. They also made it that the Public Service Loan Forgiveness Program, PSLF, they've put more restrictions on it. So now it's going to take people much longer to pay those loans back. And so long story short, it's going to make it harder for working class people to go to medical school and enter that pipeline of physicians, which I think it's really important that we have diversity there and people who know what it's like to be a regular person being doctors. And there's also going to be less payment into some of these community hospitals that train medical students. So once again, it all is like this cascading problem. So now we're going to have fewer sites to train medical students as well. So I don't know if medical schools will have to cut down their number of students. And then you can see that there'd be a doctor shortage. It just keeps going. We're taking a tower and just knocking it right over.
Yeah. And I blame the media for a lot of this. The mainstream media are not reporting on this the way they should be.
I agree with that. It's a huge problem. There's a lot of people that don't even know this happened. Or, I've heard people say, educated people say, this is fine. There's Medicaid fraud, right? So this will just get rid of it. And to that I say, when there are cases of fraud, of course, they need to be brought to justice. However, those cases are rare compared to the kinds of billions or really close to $1 trillion of cuts. There's not $1 trillion in Medicaid fraud. There's just not. There's a small amount. Of course, every case needs to be taken seriously. And the thing is, when we talk about healthcare fraud, the real culprits are going to be people like me. Like, there's physicians that are crooked and try to game the system and bill for stuff they didn't do. I mean, that's who you have to be going after if you really want to make a dent in Medicare and Medicaid fraud. So there's just red herrings that are put out that I think a lot of people believe, but that just aren't mathematically true.
Yeah, so true. Well, we got just a couple minutes left. Do you want to leave us with a closing thought?
I want to say my kids are here. I fight for them, and we should all come together and work on policies that are good for working people. And I think it's the only way forward. I think the Democratic Party has, to some degree, really neglected that.
Oh, yeah.
So we need to be pushing for universal health care, increased minimum wage. We need fair rents, freeze the rent, right, Zoran? And to that end, I am a member of the Houston Progressive Caucus and Healthcare for All Texas. And I think these organizations are, where I've learned how to fight for what I think is the real future.
Thank you.
Thank you.